Hi, I'm Dr. Molly with Your Goals Physical Therapy. If you love working out, but you also have neck pain and you are trying to get back into your normal routine of working out, but you're cautious and you're really curious what exercises might be injuring your neck or might be adding more stress, and you just want to know what you should be avoiding, this video is perfect for you. In this video, I'm going to go over the history of neck pain that a client of mine, Reya, had. It was pretty extensive, but I really believe that many people have had the exact same experiences. And so that's what I want to go over so that I can help you get back to working out the way you want to without worrying about your neck. So let's get started. Reya started having neck pain when she was about 20. Like her, like yourself, she doesn't really remember the exact time that it started, but she has memories of, being in college and having some significant neck pain. But it was the standard neck pain. You wake up, you can't turn your head, everybody ignores it. A few days later, you're fine, especially when you're 20. The beauty of being 20, right? And again, in her 20s when this first started, it would last for a day, maybe two, and she would be fine. As the years went on, she can recall that discomfort in her neck, waking up in the morning, not being able to turn, happened more frequently and also happened with more intensity. Like the pain was worse. It would interrupt more of her day. Driving became drudgery. Concentrating for long periods of time while that pain was there would be very difficult because the pain would be so severe. It also interrupted her sleep. So if she woke up on Monday with neck pain, then for 2 days, she wouldn't be able to really get a good amount of sleep. And to hear her tell it, she would be laying in bed and she's like, I knew I had to turn over, but I was questioning whether it was worth the sudden increase in pain. Because I knew that no matter which way I went, if I turned to my right, turned to my left, tried to lay on my back, there would be initial severe pain, and then it would go away. But it was just having to bear through that initial rolling over. And so she was like, it's just miserable. And so now here she is, she's in her 40s, and she's like, the pain, it just keeps coming, and it's interrupting everything. It makes doing laundry a chore, more of a chore. Laundry's already a chore. Now it's more of a chore. Doing the dishes, driving my kids to school. And the real thing now is that my husband and I have decided that we need to add working out to our everyday life. So this was a lifestyle choice that we've done. So we spend some of our quality time together working out. We encourage each other with these sports goals that we have, like being able to lift a certain amount, being able to run a certain distance. Each of us have our own goals, but we do this together. This is our time, and we're trying to instill these values into our kids as well. So this has been a big part of our family structure. So it's not just working out, it's all this other quality time that I'm missing out on because I keep getting this severe neck pain. And so, a few years before she decided, before she talked to me, she had gone in to get an MRI because the pain was so bad, it was interrupting sleep. Like I said, her and her husband had been implementing working out into their daily lives, and so this was just affecting too many aspects of her life not to go have this looked at. She has the MRI. The MRI does come back. She has a disc bulge. And just to add a little bit into this, a disc bulge is when the discs, or so the cushion between two vertebrae, so the bones in your spine, so there's a disc between two bones in your spine. When they compress and become distorted, so it no longer has its original shape, that's a disc bulge. The bulge can vary in size from something very minor all the way until what they would call herniation, which is when that bulge actually erupts and the cushioning or the squishy gel that's inside of that disc now comes out, and that the chemical inside the disc irritates your nerves and causes other problems. But so the disc bulge, the disc is still intact, it's just shaped wrong. It's not the original shape. Okay, so that's what the MRI showed for her. So back to Reya's story. So when she got that diagnosis, the doctor said that it wasn't necessarily something that she would have to jump into surgery for, that she should try physical therapy. So she went to physical therapy, and they had her doing stretches, but they never really explained what the stretches were supposed to do or what would happen long term. They did tell her that she shouldn't be doing certain exercises because it was going to aggravate things, but she didn't notice a whole lot of change doing these simple exercises they were having her do. So she stopped going after 3 or 4 sessions. Her statement to me was that she just didn't feel that they were making anything better. She didn't notice a dramatic reduction in her pain. And the medication the doctor had given her was getting rid of more of the discomfort than anything she thought was happening at therapy. So again, she just stopped. And eventually, it took a while, but eventually she said that the pain went away and life went on as normal. So fast forward 3 years when we're having this conversation, and the pain has come back with a vengeance. It's been there for 3 or 4 weeks. She has not been able to get rid of it. The second MRI said that disc bulge had gotten a little bit worse. The doctor said that it still wasn't quite to the point of needing surgery and that she should try physical therapy, which is what prompted her call to me. But she has the history, right? Why would you talk to a physical therapist? Why would you go? So her thing, she was very adamant when she called. She knew exactly what she wanted. I don't want to do a full round of therapy. I don't see the point, but I do know that the last therapist said I shouldn't be doing these exercises, but I don't remember what those exercises are, and that's all I want. So I said, okay, well, I will answer any question that you have. I will need to do an evaluation just so that I can answer that question truthfully and give you the best information. So she came in for the eval. And anybody who spends any time with me realizes I like to talk. And I absolutely love educating people about their bodies and how things move. So during an eval, it is very hard for me to stay within the confines of an hour because I talk the whole time about what I'm doing and why I'm doing it, and answering whatever questions. I think some people think this is a bit of oversharing, but I find that a lot of people, it's disconcerting when you have somebody who's poking you and moving you and bending you in weird directions and they're not really telling you anything and they're just, okay, and writing down on a chart. I don't like that when I go to the doctor, so I think I overcompensate a bit, but I digress. So Reya, when she came in, I was looking at her neck and I was pointing out, okay, this is tight, can you feel it? This is not as strong, can you tell? This is the standard, this is what we were looking for, can you see how that's not the same? I got to her posture, told her how, pointed out how her shoulders were and where they really should be and how that can add to extra strain to your neck. I talked about teeth grinding and being stressed out and how that can affect your neck. We went, and then I got a little bit lower, on her spine, and I was having her move her lower back, and she gave me this really skeptical look. She's like, isn't that a little far down to be affecting my neck? And I was able to show her through her own movements how whatever's happening at your lower spine affects your upper spine, so like your neck, and vice versa. So whatever you do with your head can oftentimes affect what's happening in your lower back. And so if one part is not stable, typically the other part is not stable either. So because it is one spine, it's all connected. And so after showing her that, she was like, that makes a lot of sense because I do have back pain and it's typically worse. And then my headaches and other things will start to happen in my neck. And she's like, but I never put that together because my lower back pain is really minor. I barely notice it compared to what happens in my neck. So we did spend some time. I was able to show her specific exercises that she should not be doing so that answer her original question. And there are certain movements. For instance, especially if you're having a lot of neck pain, you shouldn't do anything that causes you to shrug. And for some people, that's overhead pressing. For some people, that's even pull downs, anything that makes you shrug. So lateral raises for many, many people, front raises even, like I said, it can be a couple things. So I went and showed her that. So nothing that makes you shrug your shoulders and nothing that makes you extend your neck, because all of that uses the muscles that are typically tight in somebody's neck that is having these type of pains, like having disc bulges and other instability in your neck. Those back muscles are typically very, very tight. And so doing things that makes them even more tight exasperates your already injured neck. So when we got done with the end of the eval, she shocked me actually. She was like, so you can show me how to fix all of these things, all these, you're pointing out all these things. And I was like, yes. And she was like, and about how long would that take? And I was able to explain like the variations and how that would work for her. And she's like, that sounds like a plan. So we'll get started with that. And so again, at her 6-month follow-up, she definitely did not have any more neck pain. We hadn't seen each other for 6 months because we finished up that plan that I talked to her at the eval. And we had addressed all the strength deficits. We had talked about how to keep her spine stable and avoid certain things while she's working out with her husband. And so at that 6-month follow-up, she's like, I can't believe it. I haven't had any neck pain in the whole time. So since I stopped working with you to now, nothing. I haven't had any interruptions in my sleep. I haven't had to worry about needing surgery. It's like I don't even have a disc bulge at all in my neck. She's like, in fact, we're able to work out so much better and we've been so much more consistent with our workouts that we have goals now that I would have never thought about having. And she's like, I'm very excited about going into this next year because I think I might actually be able to achieve my fitness goals without worrying about my neck. She's like, this has been absolutely amazing. I'm so thankful. And that is what I absolutely love to do. I like to be able to help people get back to working out and even bust through goals or achievements that they wouldn't have thought were possible. Because most of the time when you have neck pain or any other pain, it is really hard to see past the end of that. It's very hard to see that life can be pain-free again, especially with things that you've been dealing with for 20 plus years. But there really are amazing things that our body can do if we help it heal and we help it learn how to move better. So if this is the type of service that you are looking for, feel free to click the button below that says ask about cost and availability. You'll fill out a simple little form and then my office will give you a call and we'll set something up with you. If you have very specific questions or not so specific questions that you'd like to ask me or another therapist at the office, feel free to click the button below that says talk to a therapist, because we love questions. Questions are amazing, and you really should make sure that wherever you go, they're the right fit for you. So when you fill out the little form after clicking the button, my office will set up a time so that we can have a 20-minute chat with you. Okay? And until we chat, I hope you're having a great day.